I mean, the procedure that I enjoy the most is something called a pyeloplasty to fix a blockage at the level of the kidney. Those procedures are done robotically. Um, the procedure, the surgery itself can be technically challenging at times and can definitely have its surprises along the way. But it's something where oftentimes kids will present with pain or some other discomfort that they've been having for a long time. Maybe it took them a while to figure out what the cause of that pain was. And this procedure has a really high success rate at making them feel better, improving the quality of life. So it really makes everybody feel better. It makes the families feel better because their child's not uncomfortable. The child obviously feels better because they're not having pain and nausea or what have you. And it makes the surgeon feel better because it's often a successful procedure. So a procedure that was particularly interesting that I was involved in recently with one of my colleagues was for a little child that had kidney tumors in both kidneys. And we had to perform partial nephrectomy, meaning remove just the tumor and leave the kidney behind. If there's tumors on both kidneys, you really want to try not to take both of those kidneys out, preserve them as best you can. Sometimes the types of tumors that kids get at this age can be larger or because of their size present a little more or a lot more of a challenge at removing them while preserving the kidney. We recently had one of these patients with a larger tumor on one side that definitely required me and another colleague to put our heads together to figure out how to take it out safely while preserving that kidney for the child. We have access to a 3D modeling company that can create models of the kidneys and tumors before the surgery. So we can actually practice doing the surgery on this model and get an idea of where the challenging points or pain points can be. It's something very interesting for the procedure and for families also to get an idea of what to expect from the surgery.